Last week, I have created one video related to injection and infusion CPT coding basics, as well as we have learned chemotherapy coding using decision tree, which is part 1 of injection and infusion CPT coding series. If you have not watched that video, I am going to provide that video link in the comment section of this video. Today, we will learn therapeutic injection and infusion coding part 2, where we will learn CPT codes 963652 to 96367. In today's session, we will learn definitions first, then we will learn sequencing, then we will learn CPT codes related to infusion coding. First, we will see definitions. So, definitions are very important if you want to learn or code infusions. First, what is infusion therapy? Okay. So, administration of diagnostic, prophylactic, or therapeutic intravenous fluids and or drugs given over a period of time into the bloodstream through IV, also called intravenous infusion. Most of the time, if you want to code infusion therapy, the drug administration will need to have start and stop times. So, if the patient wants to give drug to the patient more than 15 minutes, we will use infusion therapy CPT codes. Most common infusion therapy drugs are banana bags, heparin, nitroglycerin, antiemetics, as well as antibiotics. Most of the time, patient will give these drugs through the veins. Okay, so if the patient wants to give more time these drug to patient, patient will use infusions. Next one is injection therapy. So this is basically simple. So if the patient wants to give the drug to the patient in a single shot, so that time we will use injection CPT codes. In infusion therapy, patient will administer the drugs over a period of time, whereas in injection therapy, patient will inject the drug into the patient's vein in a single shot. So what is important here? Whenever you want to code injections and infusions, you need to check the documentation whether physician is providing drug over the time or single shot. If the drug administration is period of time, you need to check for start and stop times. If the provider administered the medication into the patient's vein in single shot, we need to code injection. Next, we need to understand bolus. A bolus is defined as a single large dose of medication usually injected into a blood vessels over a shorter period of time and is billed as an intravenous therapy or intravenous push. Usually we'll call it as IV push. Okay. So whenever you want to code IV push, the infusion of the drug must be less than 15 minutes. Then we will code IVP or intravenous push. As we have separate code sets for infusion therapy as well as IVP. Infusion therapy is more than 16 minutes. IVP is less than 15 minutes or 15 minutes. So if anyone looking for trainings related to same day surgery, IPDRG, SCC coding or CCS certification, please send WhatsApp message to 707-526-3939. And also if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And we need to learn sequencing. So what is the sequence of infusions? Okay. So in basics or part 1 video, we have learned all the definitions related to initial infusion, subsequent infusion, sequential infusion and concurrent infusion. Again, we will learn these things, no need to worry. So what is initial infusion? So if you want to code initial infusion, you need to check your primary reason for the encounter. For example, patient came in for chemotherapy or in order to treat the cancer. So that time we will not use infusion therapy. So that time we will use chemotherapy CPT codes. So if you watch that first video, you can learn the chemotherapy coding. So initial infusion is the key or primary reason for the patient's encounter, reported irrespective of the temporal order in which the infusion or injections are administered. Okay. most of the time your initial infusion will be the primary reason for the patient's encounter. Okay. Next we have subsequent infusion. So infusion or IV push-up is same substance or drug following an initial or sequential infusion. So what is subsequent? For example, 8 to 9 a.m. patient has provided initial infusion. Okay. So 9 to 10 also patient has administered same drug. So that one you will need to consider it as subsequent infusion. So basically subsequent means same substance or drug to initial infusion. Next we need to understand sequential infusion. So a sequential infusion and infusion are IV push up a new substance or drug following a primary or initial service. For example, same scenario, 8 to 9 a.m. patient has administered initial infusion. So 9 to 10 patient has administered new drug. So that time we need to use the sequential infusion codes that we will see soon. Okay. Next, concurrent infusion. So a concurrent infusion and infusion of a new drug or drug infused at the same time as another substance or drug. So during the concurrent infusion, patient will administer multiple different drugs in the same time. So that one considered as concurrent infusion. So this is the sequencing we need to understand while coding these injections and infusions. So this is the table for infusions. So we have four codes here: 96365, 96366, 96367. We will see those in the CPT code book. So these are the codes we are discussing. So 96365, intravenous infusion for therapy, prophylaxis or diagnosis, initial up to 1 hour. Okay, so this is the basically initial drug. Okay, so 96366, each additional hour. As it is a add-on code, you can't code 96366 separately. Okay, you need to use 96366 along with 96365 as well as 96367. Okay, so basically here you need to understand same drug. So same drug, subsequent. So that time we will use, for example, patient has administered one drug 8 to 9 a.m. and 9 to 10 a.m. So that time you will use for 8 to 9 a.m. drug, you will use 96365, and 9 to 10 also will use 96366. In another scenario, same situation and same time, so patient has administered two drugs, 8 to 9, 9 to 10. So 8 to 9 a.m. drug A. Okay, so that time we will use 96365 for initial drug. So for subsequent drugs or sequential drug, we need to use 96367. So if you want to code 96367, physician must and should needs to administer new drug. Okay, so 96366 is same drug or subsequent drug, or 96367 is new drug after the initial infusion. So like that you need to understand this. So just remember 96365 is initial infusion, 96366 is additional hour, same drug, 96367 subsequent or sequence infusion, new drug. So 96366 same drug, 96367 new drug after the initial infusion of the drug. Next we have 96368 concurrent infusion. For example, patient has administered new two drugs at from 9 a.m. to 10 a.m. Here patient has used multiple drugs, different drugs. So that time we will use 96368. As 96368 is add-on, we need to use this code along with 96365 or 96366. For example, if physician administered one drug from 9 to 9:14 a.m. So that time we will code report IV push. Okay, we will code IV push. In upcoming session, we will learn about IV pushes. Okay, as we have learned previously, if the patient administers drug less than or 15 minutes or less than 15 minutes, we need to code it as IV push. If we want to code 96365 series, the drug must be 16 minutes or more. Then only you can use these one. So for example, if the patient administered 16 minutes to 90 minutes, you need to code 96365 into 1. For example, if the patient administered 2 hours, so 96365 times 1 and 96366 times 1. So you need to understand this table is related to same drug. Okay. If the patient administered same drug, we need to use 96365 for initial hour and 96366 for each additional hour. So same drug. So this table is basically for different drugs. Okay. So for example, patient has administered one initial drug from 8 to 9 a.m. So for that drug, we will use 96365 times 1. From 9 a.m. to 10 a.m., patient will administer new drug. So that time we will use 96367 times 1. So for initial hour, drug A, we will use 96365 times 1. Each additional hour of new drugs, we will use 96367 times 1. So here also, based on the hours, we need to code these procedures. For example, if the patient administered new drugs like 2 hours, so initial hour we will code 96365. Each additional hour new drug 91 or 91 to 150 minutes or 2 hours. We will code 96367 times 1 for initial hour new drug and 96366 times 1 additional for new drug. So this is the infusion coding. Infusion therapy 96365 greater than 15 minutes to 1 hour. You will select 96365. 96367 additional new drug up to 1 hour. 96366 each additional hour less than 31 minutes to 1 hour. Okay. So 96368 concurrent infusion. Here patient will administer the different drugs at the same time. So that time we will use 96368. So during upcoming sessions, we will learn example scenarios related to all these codes. So thank you coders. So if you have any doubts, please mention in the comment section of this video. And if anyone looking for same day surgery coding training, IPDRG training, SCC coding or CCS certification training, please contact 707-526-3939.